Hello, welcome to my student support system. In today's class, we will discuss about upper respiratory tract. This lecture is in English, and if you want to study in Hindi, you can click on I button and you will get link of Hindi lecture. And you can also visit my channel, My Student Support System. Respiratory system. The respiratory system includes the organs which provide the route by which oxygen present in the atmospheric air enter into the body, and it also provides the route for excretion of carbon dioxide. The parts of respiratory system, or we can say organs of respiratory system, are divided into two groups: upper respiratory tract and lower respiratory tract. In today's lecture, we will discuss about upper respiratory tract, and about lower respiratory tract. The lecture will come soon. Upper respiratory tract. Upper respiratory tract includes three main organs. These are nose, pharynx, and larynx. We will discuss about these one by one. What is nose or nasal cavity? Nose is the anterior part of nasal cavity which is made up of nasal bones, cartilage, skin, and mucous membrane. It is the main entry gate of air and consists of large irregular nasal cavity which is divided into two equal passages by nasal septum. The roof of nasal cavity is formed by the ethmoid bone. Here you can see this is the part of ethmoid bone and nasal bones. Nasal bones is here. The floor is formed by the roof of mouth and consists of hard palate here and soft palate here. The medial wall is formed by the nasal septum and the lateral walls formed by maxilla bone. The ethmoid bone and the inferior concha. The nose is lined with very vascular ciliated columnar epithelium which contains mucus secreting goblet cells. Functions of nose. The functions of nose include warming of the air. This is due to immense blood supply of mucosa, filtering and cleaning. Hairs present at the anterior nares trap larger particles, and smaller particles such as dust, bacteria settle and adhere to the mucus. Humidification. As air travels over the moist mucosa, it becomes saturated with water vapor. And the sense of smell. The nose is the organ of sense of smell which is completed with the help of olfactory nerve which is present at the roof of nasal cavity. Now second part, pharynx. The pharynx is a tube-like structure which is approximately 12 to 14 centimeter long that extend from the base of skull to the level of 6th cervical vertebra. It has three parts: nasopharynx, oropharynx, and laryngopharynx. Upper part is nasopharynx. The nasal part means the part which is behind the nose lies behind the nose above the level of soft palate. On its lateral wall, there are two openings of auditory tube, one leading to each middle ear. On the posterior wall, there are pharyngeal tonsils consisting of lymphoid tissue. They are most prominent in children, and approximately at the 7-year of age, they start gradually become atrophied. Oropharynx. The oral part of pharynx lies behind the mouth, extending from below the level of soft palate to the level of upper part of body of third cervical vertebra. During swallowing, the nasal and oral parts are separated by soft palate and uvula. Third part of pharynx is laryngopharynx. The laryngeal part of pharynx extends from oropharynx, which is above, and continues as esophagus below, from the level of third to sixth cervical vertebra. The wall of pharynx is made up of muscles, submucosa and mucosa tissue. The mucosa varies slightly in different regions. In the nasopharynx, it is continuous with the lining of nose and consists of ciliated columnar epithelium. The oropharynx and laryngopharynx is formed together stratified squamous epithelium, which is continuous with the lining of mouth and esophagus. What are the functions of pharynx? First of all, it provides passageway for air and food. The pharynx is involved in both the respiratory as well as digestive system. Air passes through the nasal and oral sections, and food passes through the oral and laryngeal parts of the pharynx. Second function is warming and humidifying. By the same method as it does in the nose, the air is further warmed and moistened as it passes through the pharynx. Taste. There are olfactory nerves ending of the sense of taste in the epithelium of oral as well as pharyngeal parts. Hearing. The auditory tubes, which extend from nasopharynx to each middle ear, allow air to enter to the middle ear. Satisfactorily, hearing depends on the presence of air and atmospheric pressure on each side of tympanic membrane, and this pressure is maintained equal by these auditory tubes. Protection. The lymphoid tissue of the pharyngeal or laryngeal tonsils, they produce antibodies in response to antigens and become our line of defense against bacterial or viral invasion. Speech. The pharynx functions as speech by acting the resonating chamber for sound which is produced by larynx. Now, third part is larynx. The larynx or voice box lies between laryngopharynx and trachea. Until puberty, there is very little difference in the size of larynx between boys and the girls. Thereafter, it grows larger in the boys and becomes the prominence of Adam's apple, which can be seen here, and generally produce a deeper voice. The larynx is composed of several irregular shaped cartilage attached to each other by ligaments and membranes. The main cartilages are thyroid cartilage, one cricoid cartilage, two arytenoid cartilage, and one epiglottis. First is thyroid cartilage. This is the most prominent part of laryngeal cartilages. It is made up of hyaline cartilage. It lies to the front of neck here. Its anterior wall projects into the soft tissue of the front of throat, forming laryngeal prominence or Adam's apple, which is easily felt and often visible in adult male, especially when we talk. This moves up and down slightly. The interior wall is partially divided by thyroid notch. Here you can see this is thyroid notch. The cartilage is incomplete posteriorly and is bound with the ligaments to the hyoid bone above and cricoid cartilage below. So these are the parts which attaches to the hyoid bone, and these attaches to the cricoid cartilage. Second is cricoid cartilage. This lies below the thyroid cartilage and is also composed of hyaline cartilage. It is its shape is like a signet ring, completely encircling the larynx, with the narrow part anteriorly and broad part posteriorly. So this part lies anteriorly and this posteriorly. It is lined with ciliated columnar epithelium, and there are muscles and ligaments attached to the outer surface. Next are arytenoid cartilage. These are small, roughly pyramid-shaped hyaline cartilages, and number are two, one here, one here. Okay, you can see here they are attached with vocal cords. They are attached with the broad part of cricoid cartilage, forming part of posterior wall of the larynx. They give attachment to vocal cords and to the muscles and are lined with ciliated columnar epithelium. Epiglottis. Epiglottis is the leaf-shaped fibroelastic cartilage attached on a flexible stalk of cartilage to the inner surface of anterior wall of thyroid cartilage. Here, this is stalk and it is attached here immediately below the thyroid notch. It rises obliquely upwards behind the tongue and the body of hyoid bone. It is covered with stratified squamous epithelium. Now interior structures of larynx, and that is specially we will discuss about vocal cords. The vocal cords are two pale fold of mucous membrane with cord-like free edges, which extend from the inner wall of thyroid prominence anteriorly to the arytenoid cartilage posteriorly. When the muscles controlling the vocal cord are relaxed, the vocal cords are open and the passageway or pathway of air coming up through the larynx is clear. The vocal cords are said to be abducted at this time, or we can say it is open. The pitch of sound produced by vibrating vocal cords in this position is very low, or we can say nil. When the muscles controlling the vocal cord contract, the vocal cords are stretched like this. Here they are relaxed and here they are stretched. And at this time we call them adducted or closed. When the vocal cords are stretched to this extent, they are vibrated by the air passing through them to the lungs, and from lungs when the air is expelled out from the lungs. The sound produced is highly pitched. The pitch of the voice is therefore determined by the tension applied to the vocal cord by appropriate set of muscles. When not in use, the vocal cords are adducted and the space between vocal cord is called glottis. So this space is called glottis. Now functions of larynx. One function of larynx is to produce sound. The sound is produced by vibration of vocal cords. Pitch of the voice depends on the length and tightness of the cords. The volume of voice depends upon the force with which the cords vibrate, which depend upon the force of expelled air. Next is speech. This is produced when the sound produced by the vocal cord are manipulated by the tongue, cheek and lips, and the words are formed. The functions of larynx, next function is protection of lower respiratory tract. During swallowing, the larynx moves slightly upwards, blocking the opening into it from the pharynx so that the food particle will not enter into the larynx or lungs. Then passageway for the air. The larynx link between the pharynx above and the trachea below and provide a clear pathway for the air to pass. Humidifying and filtering and warming. These processes continue as inspired air travel through the larynx because larynx is also lined with mucous membrane. So this is all about upper respiratory tract. In next class we will discuss about lower respiratory tract. For getting updates you can subscribe my channel, My Student Support System, and like my Facebook page, My Student Support System. For making or completing your notes, you can visit my blogger, mynursingstudents.blogspot.com. You can follow me on Twitter, Instagram, and join Facebook group Nursing Notes. Thank you. Have a nice